Hello everyone, welcome back. Today we're going to discuss an intense topic, cardiac arrest. We're going to discuss what are the medications used in cardiac arrest. In cardiac arrest, there's just two medications that we use and it's vital to know when it is used and why is it used. So let's dive in and break down to understand the concepts. The two drugs are adrenaline and amiodarone. Adrenaline is a sympathomimetic agent and it is catecholamine derivative. Amiodarone is an antiarrhythmic agent. Let's break this down as a scenario. In cardiac arrest, you put the defib pads on and you check the rhythm. You see whether they're in a shockable rhythm or in a non-shockable rhythm. And that's how you start your process. If they're in a shockable rhythm, then you think about an antiarrhythmic agent down the lane, which is amiodarone. If they're not in shockable rhythm, then you think about adrenaline. Now let's see at what point we use them. In shockable rhythm, you shock them, you wait for 2 minutes, check the rhythm. In shockable, shock them again, wait for 2 minutes, check rhythm, shockable, shock them again. So after 3 shocks, that's when you give them amiodarone. In non-shockable rhythm, you give them adrenaline at the very first point, when you know that they're in non-shockable rhythm. Now, out of all the drugs, why amiodarone as an antiarrhythmic in shockable rhythms? Amiodarone is unique in that it is a broad antiarrhythmic agent. In the sense, it acts as if it's a class 1, class 2, class 3 and class 4 antiarrhythmic agent. So any kind of rhythm we are dealing with, the chances are that amiodarone can best deal with them. And why is adrenaline used in non-shockable rhythms? Adrenaline works as sympathomimetic activity. So it works on the alpha and beta receptors. The alpha receptors are the peripheries in the vasculature and helps in vasoconstriction. The main aim is to constrict the peripheries, blood supplying the skin, blood supplying the muscles, blood supplying the splanchnic vasculature. You don't need all of that blood supply during cardiac arrest. So it causes vasoconstriction, pooling the blood into the central system, which is to increase perfusion to your brain, that is cerebral perfusion, and increase perfusion to the heart, which is coronary perfusion. It also improves the diastolic pressure in the aorta. During systole, the blood is ejected into the aorta and it is transferred to the peripheries. And during diastole is when the blood from the aorta goes into the coronary arteries and supplies the heart. And during cardiac arrest, this coronary perfusion is important, and for that you need increased diastole in the aorta. Adrenaline improves the diastole of the aorta and that improves the coronary perfusion. Adrenaline also stimulates the beta receptors in the heart, which increases the heart rate. During cardiac arrest, it might not sound important because there's no heart rate in the first place, but when the patient draws, that is return of spontaneous circulation, then this effect of adrenaline helps to maintain the heart rate. And there's more chances of maintaining the ROSC.